And I think Amanda's point too about, and I know Malia, you've been thinking about this, sort of keeping a running tab of where you've been and where your household members have been. Contact tracing hasn't gotten a lot of attention yet because a lot of cities and counties, haven't sort of stood it up to full capacity yet. But you're very likely to get a call from a contact tracer sometime in the next 6 months. And it's going to be helpful for you and really helpful for them if you can say, like, I don't have to guess where I've been. I don't have to give you a rough sense. Like, I actually know where I've been. And I can tell you that list and I can tell you who else was there.
One of the things that I would like to see come up more often in some of these reopening plans that I've been reading is keeping track of people who are together in group settings, especially when they're together repeatedly. So this contact tracing idea, it's a huge project. We've never done contact tracing at the scale that we're talking about doing it right. No one has ever done it at this scale. And I don't really think that state governments have the capacity to do it, especially reopening as early as we are. And so it's going to take our individual level involvement in that to make it a little easier and go more smoothly. So I really do want to see people keeping track of who they're in contact with, and group organizers like, the pool or the soccer club or your family pod or your daycare, keeping track of attendance in a really specific way, in a new and very specific way.
And Malia, can I sort of piggyback off of that? So one question I've been getting from my circle a bit, this is a strong word, but you'll get the spirit of it. It's kind of a nihilism about contact tracing. Like, there's no way we'll get 100,000 to 300,000 people able to do this. So one thing I really want to amplify right here and now is that contact tracing doesn't have to be complete for it to be effective. The way that it works with exponential math and epidemics is that even if contact tracing is incomplete, if you can cut off some of the nodes, you're still going to stop the spread. So I don't think we want to be nihilistic about this. Also, we know American ingenuity and we know the things that America can do when it puts its mind to it at big scale. So I agree, we're sort of at this critical juncture where the workforce is still getting stood up, but it does not have to be complete to be effective. So go contact tracing. We're big fans. Nerdy Girls.
Johns Hopkins released a free contact tracing course.
I took it.
How was it?
It's awesome.
Yeah, right? And it's free. Anyone could go on.
So Lindsey, tell us the highlights. What are you have a PhD in public health, so maybe you knew some of it already, but what were the top 3 things that you took away?
So my 2 favorite things were, one, it provides a whiz-bang overview of COVID and the virus SARS-CoV-2. So it is like a 101. And that's the first unit. It takes about an hour, and that alone is worth the price of admission, probably more because it's free. You get the point. So they've put together really nice visuals that explain things like the difference between the infectious period and the incubation period, and what the virus is and how the virus got into humans. So again, I think it's a terrific 101 on the disease itself. I think the other thing I really appreciate about it, as someone who has trained community health workforces similar to contact training workforces in my past, is it focuses on the nuts and bolts of how to do this, right? How you make the call, how you trace the contacts. But most importantly, it really emphasizes the role of contact tracer as community builder and trust builder. So the idea is that this workforce helps people navigate the disease and the healthcare system and the exposure, even if it doesn't lead to disease. So contact tracers are really helpers. And so I hope that at their best, they will instill more trust in the system.
And for people who aren't working right now because of the pandemic, this is a job that pays $20 an hour in most places, and, a way to rally around being part of the community solution, I think. So it could be very beneficial to communities, I think, to wrap their minds around this.
Yeah, and if you're looking for just something to do and something new to learn, this free course, I've heard great things about it from Lindsey, who's not the first one who